story, public hearings on the proposed national health insurance have concluded and the bill continues to get mixed reviews. Now, the South African Medical Association is warning that the NHI will cause a brain drain, with many of its members opting to emigrate or change careers. But the Health Department is assuring medical practitioners that they are the backbone of the service delivery there under the NHI, and that the law will be passed according to the will of the people. Well, for more on this, I'm joined by Dr. Anban Pillay. He is the Acting Director General in the Health Department. Acting DG, thank you very much for making the time to talk to us. I want to start with this question. The NHI is a monopolistic purchaser of healthcare, opens its structures to large-scale corruption. That's the view of SAMA. Do you agree with that assertion?
Yeah, a monopolistic purchaser, by its nature, has that as one of its risks. It's a risk that exists with all monopolistic purchases globally. Many countries have monopolistic purchases as part of the health system in purchasing services, because this is a social good as opposed to a business. There are many measures that one would put in place in order to manage that kind of problem. And so I think the conversation needs to be about what are the potential risks that would exist in a large fund of this nature, and what measures should be put in place in the legislation and other places in order to counter that kind of risk that may exist.
And I'm glad you talk about those risks, because the next question, therefore, is, are there credible plans in place to prevent any attempt at corruption?
Yes, the bill identifies corruption as a risk. It identifies measures that should be put in place by the board and the minister in order to make sure that the funds of the NHI are protected. But remember, the bill is still in a consultation phase. Actually, there are 4 more provinces that the portfolio committee needs to consult, and then there are parliamentary hearings that must still go on. So our view is that everybody needs to contribute to the bill, to share their views about what is it that are risk mitigation measures that could be put in place, in addition to what we already have there, that could manage that problem.
The problem here, Acting DG, is that the representative of the South African Medical Association says that these are actually very real concerns, given the breakdown of trust from members of the public on government, and you add to that the lack of trust as well by the medical profession. And so a person listening to us is saying, why should we believe you?
Well, I think the option of not having a large single fund to purchase healthcare services for all South Africans is a greater risk in terms of the access to healthcare and the quality of healthcare services that South Africans will potentially receive, relative to the risk of corruption that may exist and what measures could be put in place. Many countries have large monopolistic purchases, and they've put in place many of these measures. What we've said to SAMA and many others is, what measures would you suggest we should put in place in order to make sure that we mitigate against this? Thus far, our discussions seem to be aligned about what needs to be put in place. The bill identifies a number of measures in terms of governance that must be there. The implementation is obviously critical of this, and I think over the years, as this is implemented, we'll be working together with all stakeholders, SAMA, the public, etc., to make sure that everybody participates in this process, because effectively this is a fund is meant to serve all South Africans in terms of their health care, and we have to get it right.
Talking about implementation, if implemented in its current form, again, SAMA argues that about 17,000 of its members that they represent, they're saying they conducted a survey which brought out results that 40% of that 17,000, which gives us a figure of about nearly 7,000 members, are actually prepared to either leave the country or change careers. Does that concern you?
Well, maybe we must talk about the survey first. The survey was an online survey that they did. They only had 740 respondents.
Are you saying their survey is not credible?
Well, I wouldn't say it's not credible. I think it would be dangerous to generalize from 740 respondents, the majority of which were specialists, who make up a minority of the doctors in the country. We've been around the country, to the length and breadth of the country, talking to all of the GP organizations. They're very much on board. In fact, many of them would like to sign up to the NHI tomorrow. So there's a very big difference between the way specialists perceive the NHI and the way general practitioners perceive the NHI. And trying to conflate the two may not be appropriate. I think specialists have some concerns, and their concerns are largely about the way they currently bill, whether they will be able to be price takers like they are currently, and what would their remuneration be under the NHI. And I think that discussion we need to have with them. But I think to say that all doctors, the 17,000, are concerned would be an inappropriate generalization, because 68% of the respondents were specialists, and they make up a minority of doctors in the country. The majority of doctors, general practitioners, working in general practice or working in the public sector.
Anban Pillay, thank you very much for making the time to talk to us. He is